going to talk a bit about hepatocellular carcinoma, commonly known as HCC. HCC is the primary cancer of the liver. It's the third most common form of cancer in the world and one of the leading causes of cancer death. The liver is the largest organ in the body, and it's responsible for many important metabolic functions. It cleans toxins from the blood, detoxifies chemicals and metabolizes drugs, which leads to the secretion of bile, and it maintains the right level of blood sugar in your body. Now, you may be wondering what actually causes HCC. HCC develops from underlying chronic liver disease and cirrhosis. Cirrhosis is chronic inflammation of the liver, which causes small clusters of abnormal cells, called nodules, to develop. An inflamed nodular liver is an ideal environment for malignant, or cancerous, tumors to grow. When one nodule appears, trouble is usually not far behind. The most common cause of cirrhosis and hepatocellular carcinoma is hepatitis C. However, increasingly more people with fatty liver disease and fibrosis are also developing HCC. Basically, any serious or chronic inflammation of the liver can cause these malignant tumors to develop. There are less common causes of HCC to consider too, such as frequent alcohol abuse, type 2 diabetes or inherited metabolic diseases, exposure to toxic chemicals and water contamination, and sustained use of tobacco. This is where HCC can get especially tricky. Symptoms often don't appear in the early stages of HCC. In fact, most people don't exhibit symptoms until the disease has reached its later stages. So if any of these factors put you at a higher risk, don't wait to talk to your doctor. And because your liver works so many critical jobs, signs of trouble can vary and may show up as common or seemingly minor symptoms. But blood tests, imaging, and sampling of liver tissues can catch abnormalities early on, long before symptoms appear, when liver cancer is the most treatable and there's a chance for a cure. The number of people diagnosed with primary liver cancer is growing. In fact, the number has been growing steadily since the 1980s. Knowing your individual risk for HCC and taking preventative measures is vitally important. So who's at risk for HCC? Well, this depends on a number of primary factors, including sex, age, and ethnicity. To start, HCC is much more common in men than women. On average, people are in their early 60s when first diagnosed, and more than 95% of people with liver cancer are over the age of 45. While hepatitis C is the most common cause of HCC overall, it's not necessarily the most common across the globe. In Asia and sub-Saharan Africa, the leading cause of HCC is hepatitis B. Individual risk based on ethnicity breaks down even further. Asian Americans and Pacific Islanders have the highest rates of liver cancer. African Americans and whites the lowest rates. Symptoms of HCC don't often appear until the disease has advanced, and it's important to know what the symptoms are. Unexplained weight loss or loss of appetite, feeling very full after eating very little, nausea or vomiting, pain in the abdomen or near the right shoulder blade, swelling or fluid buildup in the abdomen, itching, yellowing of the skin and eyes or jaundice, fever, enlarged veins on the belly that are visible through the skin, abnormal bruising or bleeding. The only way to know is by talking to your doctor and knowing your risk. To learn more about HCC and comprehensive treatment, visit our website or call 877-LIVER-MD.